Okay, let's talk about IHE, which stands for Integrating the Healthcare Enterprise. It's an idea. It's a concept. If you've ever heard a slogan like Buy Local or Buy American, well, in healthcare we say Buy IHE compliant systems. It's not a tangible thing, it's just an idea. Okay, so how did IHE get started? Well, it started in 1998, and it was started by HIMSS, the Healthcare Information and Management System Society, and RSNA, the Radiologic Society of North America. So we need to travel back to the 1990s. Computers are replacing paper charts in hospitals. Hospital service specific software such as radiology information systems and lab information systems are replacing manual tracking processes. PACS systems are replacing films. All these systems are being developed, but they don't talk to each other. They are all single entities. Typically, a doctor would carry around a small book with his login and password information for each of those different systems. So to care for a patient, the doctor would go into each system to place orders and review results. There needed to be a better way. So at that time, there were two major annual conventions in the country involving healthcare. One is RSNA. Happens the last week in November in Chicago, and it's the Super Bowl of radiology. Every vendor in the world shows off their new products there, and it still goes on to this year, but in the 1990s, the show was dominated by RIS and PACS. The other big conference is HIMSS. It's held in February in Orlando, and it tracks all the big healthcare IT companies. This is where all the other information systems come together to show off their new products. IHE began in 1998 with the mutual realization by HIMSS and RSNA that through cooperative efforts they could promote a higher level of interoperability among imaging and information systems. Both organizations were aware that public events could help drive the integration process by encouraging the participation of vendors and raising the awareness of users and purchasers. They convened a working group of their key members, industry representatives, standards experts, and others. This group outlined an approach that led, a year later, to the formation of the IHE planning and technical committees. And these committees have worked continuously and intensively since that time. IHE is an initiative by healthcare professionals and the industry to improve the way computer systems in healthcare share information. IHE promotes the coordinated use of established standards such as DICOM and HL7 to address specific clinical needs in support of optimal patient care. Systems developed in accordance with IHE communicate with one another better, are easier to implement, and enable care providers to use information more effectively. Physicians, medical specialists, nurses, administrators, and other care providers envision a day when vital information can be passed seamlessly from system to system within and across departments and made readily available at the point of care. IHE is designed to make their vision a reality by improving the state of systems integration and removing barriers to optimal patient care. So, IHE is an idea of integrating systems. DICOM plus HL7 gives you an integrated imaging system. The doctor can order examine the HIS, it goes to the RIS, the PACS, and the modality, and if radiology can do it, everybody else can too. So why is IHE needed? If you just look at this diagram, you see you have all these different systems, and half of them live, work, or are close to the EHR system, and then you have all these other outlier systems, and you have all these different standards, XML, XLS, HL7 2.0, HL7 3.0, DICOM into the PACS system. You have all these different languages going on. So optimal patient care requires efficient access to all relevant information. Despite the advanced state of technology, however, healthcare enterprises have not yet begun to realize the full potential of computer systems to reduce medical errors, improve the efficiency of care providers, and enhance the overall quality of clinical care. To do so requires a framework for information sharing that meets the needs of care providers as well as patients, and gains acceptance among the companies that build the systems that they rely on. Standards provide the basis for such a framework, but alone they do not solve the problem. In any standard there are gaps, options, room for conflicting interpretations. No standard maps perfectly to the complex and ever-changing information domain of a healthcare enterprise. Filling the gap between the standards and the systems integration has, until now, required expensive site-specific interface development. To close that gap, a process for building a detailed framework for the implementation of standards is needed, and IHE provides that process. How does IHE help risk PACS administrators? According to Steve Merritt at Bay State Health, IHE has become a great platform for providing practical solutions to real problems in healthcare. The IHE community is a diverse gathering of people from all backgrounds, nations, and professions, making it a great place to work jointly towards our common goal: better healthcare through better interoperability. As a vendor, being part of this community helps you build better solutions, extend your network, as a means to contribute to a pre-competitive spirit. Interfacing systems is one of the key challenges faced by any risk PACS admin. Understanding the differing implementations of standards in various vendor systems and trying to find ways to reconcile them is an expensive, labor-intensive, and often painful process. IHE offers a common framework for vendors, IT departments, clinical users, and consultants to understand and address clinical integration needs. The IHE technical framework allows flexibility while ensuring that key integration needs are met. How does IHE work? IHE involves an intensive ongoing process of collaboration and communication among key parties, which can be divided into 4 phases. The first phase is problem identification. Clinicians and IT experts identify common integration problems in access to information, clinical workflow, administration, and underlying infrastructure. Second is integration profile specification. Stakeholders select standards that address each identified integration need. The technical specifications for implementing these standards are documented in the IHE technical framework. Implementation and testing is the third phase. Vendors implement these profiles and test their systems with software tools and have face-to-face connectathons where they test interoperability with other vendors' systems. And last, you have integration statements and RFPs. Vendors publish integration statements to document the integration profile supported by their products. Users can reference integration profiles in requests for proposals, simplifying the system's acquisition process. IHE has been testing the interoperability of health information technology systems for more than a decade. At IHE Connectathons, held regularly in several locations internationally, trained technical experts supervise testing of vendor systems, making use of advanced testing software developed by IHE and several partner organizations. More than 250 vendors worldwide have implemented and tested products with IHE capabilities. So let me just talk in plain language about IHE Connectathons. They get everybody in a room, and they make them hook all their systems together, and then they do something called end-to-end testing. So from registration until a study gets a report, all of those steps get tested with these systems in a room at these Connectathons. Who's in IHE? There's all kinds of cool people in IHE. You have the American Academy of Ophthalmologists, American College of Cardiology, the American College of Clinical Engineering, the American College of Physicians, the American Heart Association, the American Society for Therapeutic Radiology and Oncology, which has a great name, ASTRO. I love that. Healthcare Information and Management Systems Society, Radiology Society of North America, and Society for Imaging Informatics and Medicine. So you have all of these different ologies in IHE. And IHE has gone international. You have the European Association of Radiology, the European Congress of Radiologists, the EuroPACS Association, the British Institute of Radiology, something in German, something in French, something in Italian. Then you have the Japan Radiological Society, Japan Society of Radiologic Technology, and the Japan Association of Medical Informatics. So notice how it's mostly all radiology society involved, particularly once you get outside of the United States. IHE started as a radiology thing, and outside of the United States it still remains focused on radiology applications. What areas of healthcare does IHE address? It addresses anatomic pathology, cardiology, dental, eye care, IT infrastructure, laboratory, patient care coordination, patient care devices, pharmacy, quality research and public health, radiation oncology, and radiology. IHE promotes integration within and across all units of the healthcare enterprise. The initial successes of IHE were achieved in radiology, and IHE Radiology remains very active. The IHE process has since been adopted in other domains as well. Working in coordination with others, each of these domains will develop its own technical framework and its own integration profiles and implement its own part of the testing and demonstration process. Domains frequently work together on profiles of common interest. Several IHE domains address interoperability issues of interest to multiple clinical fields, and these are all the different places where IHE takes place. how do I use IHE? IHE can make systems integration faster, more efficient, less expensive, and more successful. Standards-based integration solutions like those defined in IHE are flexible, durable, easier to implement, and less expensive to maintain than proprietary methods. Achieving systems integration through IHE is a dramatic step toward providing optimal patient care. Information technology professionals should know how to use IHE integration profiles in requests for proposal and purchasing agreements, and should familiarize themselves with sections of the technical framework that describe interfaces between systems under their supervision. So IHE basically is they test all the systems against all the other available systems, and they work out all the kinks so that if you buy a Fuji Pack system and a Swearingen RIS system, they should have already been tested at an IHE Connectathon, and there should be a statement that says this is how you do the configuration in Swearingen RIS, and this is how you do the configuration in Fuji Packs to make them work. You don't have to figure that out on your own. You don't have to determine that by yourself. Somebody has already done it for you at a Connectathon. Thank you for watching.